Yes, friends, now there is an interesting question. It has happened to many of you. Probably, it is a good question and a question you are wondering about. I felt a pain like a knife in my chest or an electric shock. Am I having a heart attack? This is kind of a question. Why would you have a heart attack? Now, there are 5 main reasons for this. Of course, it can be a heart attack, but I will tell you the most common causes. I'll tell you later if it's a heart attack or not. Now, first of all, don't be too scared. Why? Because about 6% of the patients who go to the ED go only for heart-related problems. 94% of those who go to the ED for such a complaint, 95% of them go to the ED for trivial reasons. What are these? 1. If you have pain like electric shock or stabbing in your chest. What is the most common reason for this? First of all, heartburn, namely reflux. You may think, what does it have to do with reflux? Stomach acid comes from your stomach. There is a valve between this esophagus and your stomach. That valve is insufficient. The acid overflows into your esophagus. Here is what is happening in your throat around or above the esophagus. Such a sudden, sharp pain can be burning. This reflux is very common. People often think that they are having a heart attack. It is diagnosed with some tests. Let's not go there. So reflux is the primary cause of this sharp chest pain. 2. What is the reason? Friends, it's some problem in the muscle or ribs. That's in the rib cage. What are these we call costochondritis? This is inflammation of the junction of the ribs and bones in the rib cage. Apart from that, inflammation of the rib cage bones, fibromyalgia or inflammation of these bones in this rib cage injury can cause such sudden sharp pains. 3. What is the reason, friends? Again, a very common and little known cause. Precordial catch syndrome. You might be thinking, what does this mean? This means that, again, there will be an electric shock-like pain in your chest, a pain like stabbing a knife. This is a very common situation, my friends, but it's a very scary thing. It happens when the nerves in the rib cage are crushed or the muscles are suddenly contracted. The characteristic of this is, this usually happens at rest or with a change in movement, may increase in stress, lasts for a short time, usually less than 3 minutes, lasts a few seconds, and the complaint goes away without a trace. I mean, it's a very scary situation, but it's a very simple reason, usually due to crushing nerves, as I said. What is another reason, friends? Heart attack. A heart attack happens like this. Of course, if you have a knife-stabbing pain, do not neglect it, but what happens in a heart attack, friends, you can never localize the pain in the chest. That is, it feels like you have a stone in your chest. There is a feeling of tightness in the chest. There is fear of death. There is sweating. Pain may spread to your jaw, neck, arm. The duration of the pain is usually longer than a few minutes. It is a very uncomfortable and frightening pain. It cannot be localized, and this pain increases with this movement. However, what is it in other cases? Your pain decreases with movement and even disappears. Heart attack pain, of course, it is more common in those with a family history of heart disease, and the chance of such a complaint related to a heart attack is higher. What is another reason other than that? Panic attack anxiety. Of course, this is very similar to a heart attack, friends. The person's heart palpitations. The heart beats as fast as a bird flutter. Sometimes there are hard heartbeats. There is a feeling of fainting. There is sweating. Apart from that, there is a feeling of badness and fear of death, which can lead to pain like stabbing a knife. Of course, this anxiety is something that increases with stress in general. The treatment for this is quite different. So what was it? If there is sudden, stabbing pain, such as 1. Panic attack due to anxiety, 2. Some inflammations and infections in the thoracic ribs, 3. Heartburn, reflux, for precordial seizure syndrome, 5. Heart diseases, heart attack. Now, to summarize this roughly, is it a heart attack or a simple cause? What is heart attack pain like? It is not localized. It is common. It is in the form of pressure, A stone is like a stone is placed in your chest. It can be reflected in your shoulder, arm, jaw pain. The pain is severe. There is a fear of death. Sometimes it can be in the form of burning. And this takes more than a few minutes. Other than that, other reasons I have listed, especially how is the precordial catch syndrome. It is like a knife stabbing, like a needle prick, but it is localized. Even like this, the person can show the location of the pain with his finger. This decreases with movement, usually at rest. It even happens or increases with changing movement. It lasts for a very short time and is an insignificant situation, friends. Yes, if you have a sudden, short-term pain like a knife stabbing in your chest, you usually don't need to be afraid, but if you have such a severe, constricting and non-localized pain, like the heart attack I mentioned before, then of course, consult a doctor immediately. Something may happen. Yes, friends, I briefly listed the reasons for this pain. If you still have questions about this, you can contact me under the video. Take care of yourself and goodbye.